Today we are going to talk about another abnormal rhythm of the heart called atrial fibrillation. It's a very common condition. It's going to increase the chance by age. When we are in 50s, 0.5% of population they have atrial fibrillation. When we get to 75, around 10% of people they have atrial fibrillation. What is atrial fibrillation? If you remember from previous videos that I have recorded on our website, atrial fibrillation is the abnormal fast rhythm of the heart from top chamber of the heart. As you remember, the base rhythm of the heart comes from a spark plug in the top chamber of the heart on the right called atrium, and it goes 50-60 times a minute. And it's regular compression of the top chamber of the heart, then electricity goes through a junction box to the bottom chamber, and the bottom chamber squeeze and follow the top chamber and pumping the blood out to the body. So we are in the normal rhythm, and then we go to atrial fibrillation. Then the top chamber, instead of regular squeeze, they go to a kind of fibrillation, quivering, shivering waves of electrical activity that they go 300 to 500 times a minute. Thanks to Lord, all these 300 or 500 times a minute, they don't go to the bottom chamber. Otherwise, it was not compatible with life. We have a junction box in the middle of the heart, which works like a gate. It opens and closes. So from this 300 to 500, depends how fast is this gate in the middle of the heart. Some of the electrical activity, they go to the bottom chamber, and that determines what's our heart rate. And that what determines how we feel them, because we don't feel our top chamber, we feel our bottom chamber. If from 300, 500 times a minute, 100 or 150 or 180 or 200 of them, they go to the bottom chamber, our bottom chamber, they go the same number, 100, 150 or 200 times a minute. And of course, faster, not good here, because the heart is not as efficient as when it goes 60 times a minute. It doesn't get enough time to fill with the blood to pump it out. So what we are feeling during atrial fibrillation varies. Some patients, they feel nothing. They come to the physician for another reason, and they find that their heart rate is fast or irregular. They get EKG or they refer you to a cardiologist like us, and we determine that you have atrial fibrillation. The downside of atrial fibrillation, number one, is driving the bottom chamber fast, and the heart is not efficient, and we want to slow it down. Number two is that when the top chamber of the heart, they don't squeeze regularly and they're just shivering, blood can stay in the corner of the heart. There is a corner of the heart called left atrial appendage, that if the blood stays there, the clot can happen. And of course, the clot through the blood circulation can go to the brain and puts us at risk of a stroke or even infarction in our organs of the body if the clot moves down to the belly or somewhere else. The main concern is a stroke, which is devastating. So for every patient, we calculate how much is risk of a stroke if they have atrial fibrillation, and we determine what to do to decrease the risk of a stroke for that patient. Let's stop here, and on next video, I'm gonna talk about manifestation of atrial fibrillation further, consequences of atrial fibrillation, and after that, we talk about the treatment option. Take care of yourself, enjoy your life. Life is good, and have a nice day. Bye.